Assalamu alaikum wa rahmatullahi wa barakatuh. I will talk today about the second lecture of oral biology within the course of pediatric dentistry, that is shedding of deciduous teeth. معاكم الدكتور شريف حسن. What about the definition of shedding of deciduous teeth? Shedding of deciduous teeth is a physiologic process leads to elimination of deciduous teeth to allow for eruption of their permanent successor. Terminology: shedding and exfoliation. This X-ray describes the presence of the permanent successor premolar within the area of divergent root of deciduous molar. Successor exert pressure to the deciduous molar, allowing them to be removed. What is the significance of shedding? Deciduous teeth cannot withstand the jaw growth from a child to adult, so another set of larger teeth must be needed for larger jaw. And this photograph of a smaller mandible and after growth become larger. Number two, growth of masticatory muscles leads to increase the force of mastication, in which deciduous teeth cannot withstand this force, and this force will transform it into trauma to the periodontal ligament. So another set of larger teeth must be needed to withstand this force. Sequence of shedding of deciduous teeth. Incisors beginning of shedding at 6 years, 7 years, and 8 years. Mandibular canine at 9 years, deciduous molar at 10 years, and 11. Lastly, maxillary canine at 12 years, in which at 12 years the maxillary dentition will transform it into permanent dentition. You must know the sequence of shedding to prevent the early extraction of deciduous teeth that might lead to malocclusion of the permanent successor. Why? Because the early loss of deciduous teeth leads to loss of space needed for eruption of their permanent successor. A sequence of shedding equal to sequence of eruption of permanent successor, as you see in the figure. Pattern of shedding. Pattern of shedding from general view depend on the pressure generated from, number one, permanent successor, number two, trauma from masticatory force. This pressure leads to stimulation of differentiation of tooth resorbing cells, termed odontoclast cells. Odontoclast cells are multinucleated giant cells similar histologically and morphologically to the osteoclast cells. طب أول حاجة هتحصل إيه؟ Firstly, the permanent successor produce pressure on the bone, separating the permanent from deciduous, and this bone will be resorbed. Then the permanent successor become facing the deciduous root and act to resorb the root itself as cementum and dentin as a hard tissue directly, with elimination of both periodontal ligament and the bulb as a soft tissue. Deciduous root need about 1 year for complete resorption. And so the beginning of shedding is at 1 year, early to the sequence of shedding discussed before. Pattern of shedding of deciduous anterior teeth. Initially, permanent anterior teeth develop in an apicolingual position to their deciduous predecessor, in which there is a plate of bone separate between the permanent and the deciduous. Movement of permanent anterior teeth go in an labioincisal direction and they make resorption to the apicolingual surface of the root of deciduous anterior teeth. Then permanent anterior teeth move incisally and they make resorption to the root at a transverse plane. Lastly, the anterior deciduous teeth shed before complete root resorption, while small part of root persists. X-ray demarcate the position of central permanent incisors in relation to the deciduous predecessor, and this photograph indicates the part of root persists with the deciduous tooth after removal. نشوف الكلام دوت بالصور. Discussion of shedding by diagrams. This is the deciduous incisors and the permanent successor, number 1. The permanent incisor move in an incisolabial direction and begin to resorb the apicolingual surface of deciduous root. Number 2, the permanent incisor become located apical to the deciduous one and begin to resorb the root in a transverse plane. Number 3, there is less than the third of the root of deciduous anterior and the tooth begin to loose. This is number 3. Number 4, the permanent incisors erupt with falling out the deciduous one. Pattern of shedding of deciduous molar. By eruption of deciduous molar, premolar become found apical to the deciduous in their divergent root زي ما قلنا في بداية المحاضرة. Premolar exert pressure on the inner side of the root of deciduous tooth leading to root resorption. الفرق بقى هنا ايه بقى؟ root resorption occur with a period of working and alternated with the period of rest. At the period of rest, there is a repair of deciduous root may be done by deposition of cementum-like tissue. ممكن يعمل لي hypercementosis. And so the loose deciduous molar become rigid another again. بعد ما السنة أصبحت إن هي loose شوية مسك التاني في جو و become rigid. Root repair may lead to ankylosis of the deciduous tooth. Continuous resorption occurred until the root become completely lost and the deciduous molar shed. نشوف اكس راي اللي احنا شفناها في بداية المحاضرة. The second premolar found within the divergent root of deciduous second molar. What about the histology of shedding? Process of shedding include number one, root resorption, and this is done by odontoclast cell. Number two, degeneration and degradation of the periodontal ligament and bulb. This is done by number one, fibroblast cells, as well as by apoptosis of the cells found within the periodontal ligament and bulb. Note that fibroblast cell that perform degradation is termed fibroclast. يبقى هي fibroblast اتحولت بقت fibroclast. And this is the odontoclast cell. طب نتكلم شوية على odontoclast cell. Odontoclast cell. What about the definition? Odontoclast is a multinucleated cells responsible for root resorption. What about the origin of odontoclast cell? Similar to that of osteoclast cell, in which they originated from blood monocyte or by fusion of many undifferentiated mesenchymal cells or ectomesenchymal cells. What about the function of odontoclast? Odontoclast make root resorption during shedding and resorption of remaining root. What is the site of odontoclast cell? The odontoclast cells found on the root resorption in a depression termed house-shaped lacuna. And also it present within the root canal and the bulb chamber to resorb the dentine. Odontoclast cells contain three important enzymes. Number one, acid phosphatase enzyme. Number two, collagenase enzyme. And number three, protease enzyme. Acid phosphatase enzyme needed for calcium resorption. Collagenase and protease enzyme needed for degradation of the organic matrix of the cementum and dentine. And this is the odontoclast cell, found within a house-shaped lacuna. Light microscopic appearance of odontoclast cell. The odontoclast cells are large multinucleated cells from 8 to 20 nuclei or more than 20. Number two, the cytoplasm of the odontoclast cell are acidophilic cytoplasm, which appear red in color. Electron microscopic appearance, there is a little rough endoplasmic reticulum and Golgi complex, numerous amount of mitochondria that produce citric acid and the need to more energy required for process of shedding, lysosomes, ruffled border. The border of the cell facing the resorbing root appeared striated. Ruffled border act to increase the surface area of the working site. Clear zone. The region of cytoplasm adjacent to the ruffled border are not contain cell organelles, but contain only actin and myosin, and this needed for adhesion of the cell with the house-shaped lacuna. Process of shedding. Number 1 dental hard tissue resorption. A. Dental hard tissue decalcification. Firstly, removal of cementoid tissue covered the cementum by the action of odontoclast cells. Removal of calcium by the action of acid phosphatase enzyme and citric acid secreted from the odontoclast cells. Number B. Organic matrix degradation. Collagen breakdown into protein occurred by the action of collagenase enzyme. احنا لسه قايلينه من شوية في الثلاث حاجات. And this collagenase enzyme secreted from the odontoclast. And the second is the protein breakdown into amino acid by the action of protease enzyme. Clearance of the waste product into the bloodstream by the action of blood monocyte. آخر حاجة dental soft tissue degradation. اللي هم مين؟ هم periodontal ligament و bulb. What is the process of degradation? Dental soft tissue degradation occurred by the way of apoptosis, which means physiologic programmed cell death. The degraded part of the bulb is the only facing the resorbing area, and the remaining of the bulb include bulb chamber is normal. هنشوف بقى شوية حاجات clinical. What is the clinical consideration of shedding? ممكن سنة deciduous retained within the jaw, and this lesion is termed retained deciduous teeth زي ما انتم شايفين في الاكس راي. وده ممكن السنة تتنيها deciduous teeth في فم المريض لحد ما يبقى عنده 32 سنة. وده نتيجة ايه؟ نتيجة انه ممكن يبقى في انودونشيا to permanent successor وممكن يبقى permanent successor are impacted. Number 2 submerged teeth. The deciduous teeth is shorter than the permanent one, and when deciduous teeth persist or retained, they become out of occlusion and termed submerged teeth. Lastly, remaining root. There is the remaining root of deciduous teeth persist within the jaw, and this is not important and may be resorbed by the action of odontoclast cells. انتهت المحاضرة. أشكركم على حسن المشاهدة والاستماع، وأراكم إن شاء الله على خير. ولو حد محتاج يسأل أي حاجة يجهز الأسئلة ويتواصل معايا فورا. أشكركم والسلام عليكم ورحمة الله وبركاته.